It's an honor to be here to talk to you guys today. I'm going to tell you my childbirth story and the life-threatening pregnancy complication that I survived. I will tell you about my patient care here at Inova Fairfax and the emotional and physical recovery, and then also how my husband and now my 6-year-old son became a family of 3. So I came to Inova in 2012, 6 years ago. I was 38 years old. I had 2 miscarriages 2 years prior. I found out that my miscarriages were caused by an anomaly I was born with called a uterine septum, and I had to have 2 surgeries to resect that septum. With the 2 surgeries that I had with my miscarriages, I had a total of 4 uterine surgeries before the pregnancy with my son. And I actually already knew that there were risks with any surgery, but one of the risks for having multiple surgeries was incompetent cervix. And I advocated to be monitored really, really closely to make sure my cervix didn't shorten. And sure enough, about halfway through my 2nd trimester, I found out that my cervix shortened and I was briefly hospitalized. I was sent home and put on bed rest for 2 months. And I was okay with that because I knew I did not want to go into preterm labor and I did not want to deliver a preemie. So I was okay with sitting on the couch for 2 months. I then went in about 5 weeks before I was due to deliver to have an ultrasound. And at that time, it actually wasn't my cervix that was the issue. It was my placenta. It looked very suspicious. There seemed to be no separation between the placenta and my uterus. And I found out that my placenta was growing through my uterus. And this is a condition that's called Placenta Accreta. Placentas are supposed to just hover over the uterine wall and then detach after birth, but sometimes it can attach too deeply and can grow through the muscular layer, and sometimes grow completely through the uterus and attach to other organs, like the bladder or the bowels. And it tends to happen in patients that have had some type of damage to the lining of their uterus from possible C-sections, D&Cs like I had, IUDs, IVF, and that can somehow make the placenta attach too deeply. And because of the increase of C-sections and other uterine surgeries, accreta has risen over the years. And it now occurs in 1 in every 272 pregnancies. The rates for accreta have quadrupled since the 1980s. So with the suspicion of accreta, I was sent to have an MRI. And I was actually terrified of having an MRI while I was pregnant. I was worried about my son. I was worried about what it could do to his health. And I was worried about the results. And a few days later, I received a call, and unfortunately, it was placenta accreta. Immediately, I was sent to Inova Fairfax. Where I was prior, they couldn't handle my situation, and they transferred me here. And this is where there's actually an accreta center of excellence, where there's doctors that can handle and manage accreta. They have experience doing it. And at that time, I was completely overwhelmed. I did not know what accreta was. I did not know what it meant and what it might mean to me and my son. But I found out that my doctors here, my new doctors that I just met, were familiar with this. They knew what to do. They could manage this complex situation. And they started to put together a plan. And the plan included delivering immediately, because the issue with placenta accreta is there's a huge risk for hemorrhaging, and you needed to be close to a hospital and you need to deliver. It's like a ticking time bomb. You don't want to be outside a hospital and all of a sudden start bleeding, because you could bleed out very, very quickly. I would deliver immediately, and they would prepare for a hysterectomy. And a hysterectomy is not common to be done on a pregnant woman. And because of that, there's also a risk of hemorrhaging, and it would have to be a very well-planned surgery with many experts and specialists involved. But overall, I had a few things in my favor. I was 36 weeks along, and I knew if my son was to be delivered at that gestation, he would likely be okay. There are many Accreta moms that are diagnosed with Accreta much earlier than I had been, and those moms have children that are usually in the NICU and in the NICU for some time. So I was lucky. I also was to deliver immediately, so I would not have to be on hospital bed rest. And there's many Accreta moms that have to be in the hospital for months, weeks, awaiting their delivery date. And finally, I found myself at one of the best hospitals for Accreta, and 20 minutes away. How lucky am I to be that close? Many Accreta moms have to travel hours, sometimes across the country, to find the best care. Regardless of the positives, I was absolutely terrified. I would have likely a hysterectomy, which means that I would not be able to have any more children, and it wasn't my choice. And I would all of a sudden just be in survival mode. I had to think about all the things that I had to do before my son arrived. I had to pick a name. I had not even thought about what I was going to name my child. I thought I had more time to do that. I had to buy all the things that you need to do to get ready for a newborn. And I had to think about the what ifs. You know, what if I didn't make it? I had to make sure my will was ready, living will. I had to possibly write letters to my family. Those are the things that really terrified me. But what I really appreciated about my care here is the doctors didn't sugarcoat their words. They told me the truth, and they prepared me for what could happen. And the morning of my surgery, the anesthesiologist sat down with myself and my husband, and it was the first time that somebody told me that I could die. And it's the first time I cried. I knew it obviously could happen, but for somebody to say that to me, I really appreciated that they were truthful about the situation. And as the day of getting ready for the surgery, this is not your typical C-section. With an Accreta surgery, there's sometimes more than 21 specialists in the room. With a routine C-section, there could be as few as 7. There was my OB who would deliver my son. There was the gyno-oncologist that would prepare for the hysterectomy and take care of that. There would be radiologists, there would be sonography, there would be the blood bank personnel. There are many experts involved and in that room that day. And that morning of my delivery, I found out that I was going to be awake during the entire surgery. I would just get a spinal. And I actually was grateful for that because that meant I would hear my son's cries and see him right after he was born. But that also meant that I would hear my doctor say, "It's not coming off." And at that time, I knew I would be getting a hysterectomy. After that happened, my son and my husband were ushered out of the room really quickly, and surgery began. And I remember laying there with my arms strapped out, IVs, A-lines, and I remember being absolutely freezing cold, shivering. And I remember looking up at the light in the OR thinking, I really shouldn't look at that because I can see the reflection and maybe I could see the inside of my abdomen if I looked at it close enough. So I tried not to look at that. And I heard my doctors talking. I heard them telling to clamp here, clamp there, and what to do next. And then I also heard the call to the blood bank. and that meant I needed blood. But there were also many comforts. In the OR, the anesthesiologists, the other staff, they were so comforting to me. They talked to me. They made sure I was okay. They talked about other topics to get my mind off things. They played music, and I remember exactly what the music was. And those are the things I remember, the comforts, the compassion. I still remember them 6 years later. When I was finally reunited with my husband and son, obviously I had made it, and they were in the recovery room. They were sitting beside each other, my son in the bassinet, my husband sitting next to him, and I just remember they had been sitting there for over 3 hours waiting for me. And I thought to myself, well, why hasn't he picked my son up? And he told me later that he was absolutely petrified to pick up a newborn. And but he also told me that he wanted privacy. He didn't want anybody else there. That's what he wanted, and that's what he was given. And I later very much appreciated that as well. I was transferred to my first recovery room, and I was in a different part of the hospital. I was not in labor and delivery, and I remember it being very quiet, isolating. And I just remember not being in the area where all the other postpartum moms were. And I was really sad about that. And of course, at the time, I was bloated. My body was twice the size that it should have been. My legs were in the compression wraps. My abdomen looked like Frankenstein. The fluid coming out of my drains smelled like fruit punch. It was not a fun time, and the pain was absolutely unbearable. But I just remember the nurses being so compassionate and helping me manage the pain, and that was, of course, really appreciated. I was then transferred to a new room where I got a lot more postpartum support and of course, great care from the nurses and staff, and felt somewhat normal as a postpartum patient, like everybody else there. And again, just treated with great comfort and compassion and empathy. I eventually did go home with my son and my husband, and it was extremely difficult going back to work only 3 months later. Recovery was really, really difficult and hard. And the one part about it was the back pain. I had excruciating back pain for over a year and kept thinking, what can I do about this? And finally was able to find the care for that, and also was able to find a physical therapist that could help with the adhesions in my abdomen. I was able to find some care over that recovery time for my body. But what I wasn't ready for was the emotional and mental recovery, because I was extremely sad. I realized, of course, that I couldn't have any more children. And again, that wasn't my choice. And I also had extreme survivor's guilt, because there are unfortunately some Accreta moms that don't make it. And I thought, why me? And then I also felt very alone, because I didn't know anybody else that had been through any kind of traumatic childbirth or an experience like this. I didn't know anyone else that had Accreta. And a year and a half later, I finally found my first Accreta support group. There was actually hundreds, and now there are thousands of women in these support groups. And I finally found my home. I received great support. I finally found people that understood what I had gone through. We all were in the same boat. And it was just wonderful to find that family. But what I also realized when I was meeting all these other Accreta moms was that I needed to be grateful for what had happened and for the outcome of what had happened. And I had to be positive. I had a healthy son. I was healthy. I was okay. And we thought about the things that I could do to help give back. And one of them was giving blood, because one of the reasons why I was alive was because of blood donors. And so I started hosting blood drives and teamed up with a lot of other local Accreta moms where we all came together and we would host a blood drive and help other Accreta moms, possibly on bed rest at the time, make sure that they had blood for them. And of course, others that would need it. And we called them Heroes for Moms. And it was great because I eventually just developed a great relationship with Inova Blood Donor Services. And of course, Inova Fairfax, where I kept in touch with my doctor. And I was able to find out if there were other Accreta moms on bed rest, awaiting delivery, and making sure that there was enough blood for them. So I would put out blood pleas to my networks and all of our networks. And the response was amazing. People were able to understand the need for a mom. And everybody has a sister or a daughter or a mom, of course, but possibly could be in need. And it was wonderful to be able to feel like I was doing something good and giving back to those that possibly saved my life. And as I look back and reflect on my patient experience here, there was definitely or a lack of resources for Accreta specifically. And, at the time, there just weren't any. Right now, there's actually lots of resources. There's the National Accreta Foundation now, then that is building resources for patients and for providers. There's a Hope for Accreta Foundation that has support groups on Facebook now with thousands of Accreta moms. There's Heroes for Moms that now has a blood drive toolkit that's available for survivors that want to host a blood drive and help them do it. And now there's also a new patient coalition called Mama's Voices that is bringing other survivors, near-miss survivors together to help advocate for change. There's a lot out there now, thankfully. But there's also postpartum resources that I wasn't even aware of. Like I said before, there's therapists that specialize in birth trauma. I didn't even know that existed. There's therapy for anxiety, for PTSD, for postpartum depression. All of these things that I did not know existed and now do, and did at that time, but I just was unaware. And I just felt that that was just a missed opportunity for me. And I really hope that hospitals and doctors will provide those resources to patients and even in follow-up appointments, because even though a patient might not know that they need it or may not need it at that time, they may need it in the future. While this was just a one-time event, this is something I will live with for the rest of my life. My recovery will never be over. But there are a few things that I learned from my experience. And the first one is all moms, I believe, deserve great care. And I think it's so important for a patient like myself. If they're not getting great care, they need to advocate for it. If a doctor feels that they can't handle an Accreta case, they need to transfer that patient to another hospital that can. And I was lucky. I got great care. I also learned and realized that moms like myself need access to safe blood products. And they need to be in a hospital that has a blood bank that has access to that blood. And if a patient is not in a hospital with Accreta with a blood bank, they need to get to one. And I also learned that it's really just extremely important for patients like myself to get support. and to not feel alone. And I finally found that support, and I was lucky. And finally, I believe that moms all deserve to know about Accreta, and that doctors need to inform them if they're at risk for Accreta in future pregnancies. I was not aware at the time. And I also believe that I would love to have a future where women like myself, anyone that's going to be pregnant in the future, that they're aware of Accreta and that they don't have to Google it. They know what it is. I'd love to thank Inova Blood Donor Services and Inova Fairfax for the amazing care I got here and my family got here. Not only did both of you save my life, but you also saved my family. We came home as a family of 3 instead of a family of 2. Thank you very much. This is my son and my husband.
Well, thank you so much, Alexis, for sharing your compelling story with us. I know there's questions probably from the audience about your experience with Accreta and your ongoing recovery, but I'd like to kick it off with a question from me. In an effort to increase awareness, what's the one thing you would like to make sure that these caregivers in the audience know before they leave this presentation today?
The one thing?
Or a few things.
I touched on a lot of it during my presentation, but I feel that I would love everybody to just be further aware of Accreta and be able to inform patients if they're at risk for it. I would love everybody here to make sure that patients have the resources for not only the physical recovery, but the emotional recovery.
Great. Also, you mentioned there was alarming need for blood, especially with women with Accreta and complications. What can we do? What action can we take that you find that we may need to do better or more?
Oh, definitely donate blood if you're eligible and donate regularly. Blood is needed all the time. So it's so important if you're eligible to get on a regular schedule to donate. And if you can't donate, encourage others to do so.
Do we have any other questions from the audience for Alexis about her experience, or we have someone down here?
Thank you so much for sharing your story. I certainly learned a lot. I was wondering if you know of anything else that I can do, since I'm from Europe and I used to give blood on a regular basis, but now I'm sure you know if you're from Europe, you can't give blood. So is there anything else I can do to help moms like you or anyone here?
Encourage others to donate blood and share our stories. And that, one of the biggest uses of blood, of donated blood, is for childbirth, for mothers during childbirth. So I think it's just important to know that there's many uses for blood. It's not just trauma, somebody in an accident or somebody that's sick. So encouragement to continue to donate blood.
Any other questions, Dr. Maxwell?
Yeah, thank you for your talk, and we really appreciate you being an advocate for our local community. I'm going to make a comment and ask you a question, but I'm also going to ask the audience a question. How many people in the audience recognize that cesarean section is the #1 risk factor for having an Accreta? Okay, now I'm biasing because I've got a lot of women's. How about people who are not part of women's? How many people recognize that issue? So very few, because the concern is that women who have repetitive sections, for whatever reason, and we don't understand the biology of this disease, have a significantly increased risk of CRETA in future pregnancies. And so I think that we try to have our providers educate patients on that, because C-section seems like, hey, it's an easy way. I've got a busy schedule. I can schedule my section. I can get my baby delivered, and it's not a big deal. But what it does is it sets future state for having more and more potential complications. So the awareness piece, definitely got to be out there. I think the second piece is that the blood product issue and trying to get people more active in providing blood products is important. I think even more importantly, though, is getting to the right place to get your surgery, because what we want is to have a surgery that doesn't have blood loss that necessitates an actual transfusion. And I know that over the course of the past 5 years, we've done, seismic changes to our department, such that we used to be one of the highest institutions within the CWISH consortium for hemorrhage, and now we're the lowest. But it goes towards identifying those patients at high risk, getting them in early, getting them in with these teams that are going to focus on trying to minimize the risk of adverse bleeding. So that's it's really critically important to make sure small hospitals, channel patients to larger hospitals.
Absolutely.
I think my question to you is, what can we do to enhance development of an advocacy group that perhaps Inova could champion for not just DC, but the region? Because I think that if you're someone who's diagnosed with a CRETA, you go online and you see all the scary stuff.
Yeah.
What you need is kind of that sisterhood that you can plug into to say, look, with the right care, being in the right place, you're going to get taken care of. And it doesn't mean it has to be here. It could be at other regional centers in the area. But what could we do to help in facilitating and supporting that kind of a development?
Well, I would say that I think there could be a way to leverage survivors like myself to help those that are going through the situation right now. We're doing a little bit of that right now with the great partnership I have with Dr. Nyes and others, where I can help the CRETA moms that are going through this currently, help guide them through that journey. But putting maybe more systematic approaches to it would be really, really great. Make it easier for CRETA moms to know where to go, to who to contact, and maybe something local in the hospital for CRETA moms. But that's what I would love to do and help with, because I think there's a great opportunity for moms that are feeling like they're alone in this, and that they're not alone. There are, unfortunately, many of us that have gone through this, and I can use that experience to help them and make them feel like they're not alone in this.
I think having a coach is almost like cancer. Some institutions have, if you're a newly diagnosed cancer patient, getting aligned with a survivor can
Like a
be
mentorship.
inspirational
Yeah.
and really help.
Yeah, absolutely agree. I hope that's something we could do.
Any other questions for Alexis? We have one over here.
Hi, Alexis. Thank you for sharing your story. Would there have been any warning signs or symptoms that, had you been more knowledgeable about the disease, that you could have looked out for?
I don't think so. I think what could have possibly been done differently is that I was aware before my pregnancy with my son and tried to limit the number of surgeries that I had prior. Like what was just said, the C-sections are definitely the largest contributor, but with me, I didn't have a previous C-section. I had 2 D&Cs and 2 hysteroscopies. Of course, some surgeries are necessary, but some aren't. And I think if I would have possibly looked into other options, and because I would have been more aware of the possibility of the risks involved with those surgeries, I may have done something differently.
Hi, and thank you for your talk. It was very inspiring, very enlightening. But one of the things that I'm curious about is the overall experience that you've had, not just clinical. When we provide services here, of course, it's kind of holistic in that we look at all aspects of care, the physical, the emotional, the psychological aspects. And I'd be real curious as to what are some of the things that really stuck out in your mind that we did to really ease your fears, make you feel good about the process that you was going through, and what was going through the mind of your husband. We know that your son was waiting to come out into this world, but what were you guys doing and what were we doing to support your mental status?
I think trying to put me at ease, there are things definitely that were out of our control, but listening was a key aspect. I felt like everyone here listened to what I was saying, whether it was about my pain, whether it was about just better understanding my situation, and that's the one thing that really stands out, is the listening part. But I do feel like when I look back at it, I mean, it was 6 years ago, but I don't really remember talking about what to do about the emotional recovery and the mental recovery. I honestly don't recall ever talking about what that could be like. And that's what stands out for me about things that could improve and the resources that could be shared with patients like myself. I really don't recall ever being told about support groups, about therapy, and that those things are out there for me. But while I was here, the care was outstanding, and the listening, just stands out from my experience.
And Alexis, just to piggyback on what you were saying about how the staff was taking care of me and Griffin after he was born, I cannot say enough about how the staff took care of me and Griffin after Griffin was delivered. They were able to pick up that I was absolutely petrified. Petrified to have a newborn baby, petrified that my wife's life was in peril, and that I just needed some privacy. They picked up on that, and they let me have a good 3 or 4 hours alone just with Griffin, and I can't say enough about how supportive the staff was during that process. So,
Do we have any other questions? Oh, yes? Griffin.
So, how awesome was I? Like, super awesome, or was I, like, super awesome or awesome?
You put him up to that, didn't you? You are super awesome. You are just awesome.
Okay. All right. Well, thank you, we have one more question?
I don't have a question for you, Alexis. I just wanted to say thank you so much for all of your advocacy, not just with Placenta Accreta, but for Inova Blood Donor Services. You have been a mom on a mission to make sure that every mom that comes through Fairfax that has Accreta has the blood that they need. You know before we know, and I think it's because you have taken this on as your personal mission, so no one has to go through that. They're going to go through it, but with support and love and guidance. And when we go out on appeal, because there are moms waiting to deliver, because you've shared that with us, we have what is needed on the blood bank shelf to provide for those moms. Sometimes they don't use it all, which is a blessing, and sometimes it's just what is needed. So thank you so much for all of your advocacy.
I'm happy to do it. I love doing it.
Any other questions before we end? Well, I just want to thank you, and I'm sure the audience, thank you for sharing your compelling story.
Yeah.
We greatly appreciate it.
Thank you for having me. I really appreciate it. Thanks.